Canadians might brag about universal health care, but data shows health is not a universal experience.
We're seeing here racial inequalities that play out literally in death, because we're talking here about mortality. This is about people dying from these conditions.
A report released by Statistics Canada highlights how Black adults face an increased risk of death from certain diseases compared with their white counterparts. The report's author says the findings can help inform better healthcare decisions.
It's important because it's a first step in reducing health inequality. If we don't have information, we don't know what we're dealing with.
For Black men, the relative risk of dying increased by nearly 140% for those living with HIV/AIDS, 42% in pancreatic cancer patients, and nearly 20% for those with prostate cancer. For Black women, the relative risk of dying increased by 500% for HIV/AIDS patients, 98% in mouth cancer patients, 56% for those with stomach cancer.
This is the first national study to look at mortality in Black adults. Doctors and advocates say the results indicate the gaps in care for Black Canadians.
Some of these conditions, so things like HIV, diabetes, cardiovascular outcomes, are conditions that are either preventable or they can have very good outcomes if they're caught early. So what this means is that there's a miss, right? There's a miss when it comes to prevention, a miss when it comes to screening.
Advocates are calling for attention and action at the national level.
Kind of strategy that mobilizes the investment, it mobilizes the research, and then mobilizes the focused interventions that are necessary to address these issues over the long term.
We want to be able to see this as a first step that we describe, we find out, and now we have to figure out why and then address and eliminate these disparities.
Katherine Ward, Global News, Toronto.